Welcome back to 12 Days in March. In this section, we'll review Parvovirus B19. If you are keeping a list of the top 10 viruses, put this one on it. So why does the NBME love parvovirus? First, they can test you on the virologic properties. That's boring, but they can describe a parvo-related syndrome that you'll be proud to identify, such as erythema infectiosum, and then ask you to select the correct virus based on virologic properties, such as envelope and nucleotides. So do be familiar with this tiny, naked, single-stranded DNA virus. But here's where it gets exciting. Parvovirus is an erythrovirus. That's big. It infects RBC progenitors in the form of pronormoblasts. That gives them a virus with hematologic manifestations, which means there are test-worthy derivatives. And finally, the virus has two immune-mediated syndromes that add a little spice. So between the hematologic and immune-mediated manifestations, they do love this virus. So let me start with the hematologic manifestations. There will be 4 specific scenarios. I would quickly highlight the name B19 comes from its original identification. The virus was discovered as a false positive screen on blood samples being tested for hepatitis virus. The false positive was noted in panel B, patient sample 19. B19, that's great stuff. So scenario 1, we have a healthy patient. Noted is a normal bone marrow. The normal bone marrow has erythroid progenitor cells, including the pronormoblast. So what happens when the pronormoblast becomes infected with a small, naked, single-stranded DNA virus? That is, the parvovirus. What's the outcome? Answer: a mild, self-limited anemia. The patient is unlikely to even be aware. So far, so good. Scenario 2. Now we have patients with medical conditions associated with chronic hemolysis. Sickle cell anemia and thalassemia have defective globulin chains, and spherocytosis has a defective RBC cytoskeleton. The conditions share in common premature destruction of RBCs that results in a reactive bone marrow termed erythroid hyperplasia. So what is the outcome of parvovirus infection in patients with chronic hemolysis and dependence on a bone marrow that is chronically revved up to maintain a normal red blood cell mass? That is, what happens to these patients if you whack out one of the erythroid progenitors? Answer: transient aplastic crisis. You've just knocked out the red cell line. So why is this transient? And why is it a crisis? As for the crisis, hemolytic conditions require a reactive bone marrow to maintain adequate RBC mass. When you knock out the bone marrow in these patients, especially compared to the normal patient, there is a profound drop in RBC production to the point where transfusions will be required. As for the transient nature, that is explained in one word: immunocompetent. Immunoglobulins result in viral clearance. Goodbye virus. The immunocompetent patient is able to clear the virus, so whereas they are impacted by infection of the erythroid line, their bone marrow makes a full recovery in 1 to 2 weeks. And that is a good introduction to scenario number 3. Now we have an immunocompromised patient. They are infected with the same little single-stranded DNA virus. What's the outcome in this scenario? That is, what happens to the normoblast if you can't clear the virus? The answer is aplastic anemia. And why isn't this transient? There is no humoral response. No humoral response means no viral clearance. No clearance, and the progenitors can't recover. Chronic aplasia. That's not too good. And finally, here is the 4th hematologic scenario: the fetus and parvovirus, especially if less than 20 weeks of age. Recall that the first 6 weeks of hematopoiesis takes place in the yolk sac, with the liver and spleen picking up production thereafter. The bone marrow doesn't take over the load until the 3rd trimester. Now the fetus gets infected via vertical transmission, and the results is hydrops fetalis of the non-immune variety. RBC production is seriously compromised with severe anemia and failure of oxygen carriage. This results in high output cardiac failure, meaning oxygen is not getting delivered to end organs. Fluid accumulates as it would in any other situation of volume overload. Just be aware that hydrops is another hematologic, not immune manifestation of parvovirus. And just to summarize, we have 4 scenarios: the healthy patient, the patient with chronic hemolysis, the immunocompromised patient, and a fetus at less than 20 weeks of age. They each manifest injury to the erythroid progenitor in unique ways that the NBME can hardly resist. Let's shift gears to the immunologic manifestations of parvovirus infection, and then we'll be all done. Here we have fifth disease, or erythema infectiosum. The classic description is the slap cheek appearance. I prefer the description of a cheeky smile. If you understand why he is smiling, you understand this disease. So here's the presentation. Following exposure via the respiratory route, there is a viremic phase characterized by a mild febrile illness. The rash, however, does not appear until after the viremic phase. That is, the virus is gone. The rash is an immunologic manifestation. No virus will be cultured from the skin. So why is the kid smiling? The acute phase of the illness is resolved. The rash is a secondary manifestation. The other immune-mediated manifestation of parvovirus infection is arthropathy. As with fifth disease, the joint symptoms follow the viremic phase. The virus is not typically cultured from the joints or synovium. The arthropathy presents with rheumatoid arthritis-like symptoms, including involvement of the small joints of the hands and wrists. The NBME may clue you in by mentioning an RA-like illness that resolves in 3 weeks. In RA, you wouldn't expect resolution. That the arthropathy resolved in 3 weeks is the clue they are looking for a pseudo-RA-like condition. Other clues will be the demographics of the patient. They love to target teachers and mothers as they have exposure to infected kids. The classic question would sound something like this. An adult develops wrist pain following exposure to a kid who had a viral syndrome that included a facial rash. They'll expect you to put together RA symptoms with a viral infection that included a facial rash. That's what I got. This is the face of parvovirus for the boards. If you just remember this is an erythrovirus with immune manifestations, you should do just fine on the parvovirus questions. If you have any questions or concerns, email me at 12DaysinMarch. Thank you.